Okay, so real quickly, the things that people may do for treatment that you may or may not hear about as employers, as service personnel, as co-workers, as supervisors, but these are the things that people may be doing. Medication management does not make the symptoms go away. Medication management has as its purpose taking the edge off, taking away the worst of the anxiety, the depression, the anger, possible suicidal thoughts, homicidal thoughts, so that a person can be functional in their job, in their personal life, and in therapy, which will make the symptoms go away. So, if someone is taking medication, it's not going to change their personality, it's not going to change their beliefs, it's not going to change who they are. And this is a worry that a lot of our service members have and why they resist taking medication. Its primary purpose is just to take the edge off, because these symptoms can be pretty overwhelming. Individual therapy, when you're talking about trauma-focused therapy, is an intense processing of that trauma or those traumatic experiences. It is talking about it. It is breaking through the avoidant tendencies and making people do what they don't want to do. And for that reason, a lot of people don't follow through with it, or they avoid the worst of it. But this therapy is really important for people to do. So if you have someone, perhaps, that you're working with that, takes an hour every week and goes to therapy to deal with a combat-related issue, this might be a very, very important thing. Stopping this process early is kind of like stopping an antibiotic before your infection is totally gone. It does no good, and then you have to start over when it comes back. So this is an important process to keep going. Group therapy does some of the same things. Focuses on the trauma experience. But the group experience, whether we do it in a class or a group, is actually really useful. Because if you think about what these symptoms are like, and if you think about the people you know who have had them, maybe you've even had some yourselves from that stress reaction, you feel kind of cut off from everyone else around you. You wonder, does anyone really understand what I'm going through? And you don't want to ask, because if they say, no, you're crazy, you're going to feel that much worse. So the group experience allows you to actually sit in a classroom or a group room and hear someone that you've never met before across the room telling your story. And you're thinking, wow, I just felt that way yesterday. That means I'm not alone. And that is hugely beneficial. So the group experience, as much as people dread it, is actually very useful in treating post-traumatic stress disorders. Now, non-medical interventions. This is another thing to start, so I did it for you. These are the things that everyone can do, and I highly recommend you try them out if you think any kind of psychological problem or illness or injury is going on. These are universally good approaches. So, first and foremost, practice your empathic, non-judgmental listening. If you tell someone who's telling you, I felt kind of weird, I felt like I thought I had a hallucination, and you say, wow, you're crazy, have you seen a doctor? That's it. They're not telling you anything else. But if you can listen and just say, wow, that sounds like that was pretty scary for you. Try and be empathic. Think how you would feel in their shoes, and how much courage or desperation it must take for them to be telling you. Try and listen that way. Educate the individual about the symptoms. You've had some education now. If someone tells you something that you remember from this presentation, you now have the knowledge to say, I've heard this happens and that's actually pretty normal. That's going to go a long way towards reassuring people that they're not crazy. And that's the knowledge they need to have to get better. Ensure basic care. If you notice someone is working 23 hours of the day and then attempting to sleep for the other hour, that's not healthy. Encourage sleep, food, exercise, social communication, hot showers every day, maybe even twice if they exercise. These are all good, common sense things, but you'd be surprised what people forget when they're suffering. Help the individual find support. You know, maybe you know 2 people that work for you or work with you having similar experiences. And yeah, you don't want to tell stories about the other, but maybe you can get those 2 together and say, hey, I think you guys may have some things in common. You know, you were both deployed around the same time. Maybe get them talking. Or maybe just suggest that person take a few days to go home on leave. Or talk to his own friends that he already has established. Again, anything that makes them feel less alone and less crazy is really important. Encourage pleasant events. Encourage relaxation. Yoga is actually a great thing. My male Marines usually laugh at me when I say this, and then they try it. They're like, you know, that actually kind of worked. So relaxation classes, techniques, they're actually really healthy. I can tell you they really do work, and I have my own doubts. Realistic expectations is important too. You know, don't tell someone, oh, it's going to be okay. You know, this is all going to get better, if you're not sure that it will. But it's okay to be optimistic and say, hey, are you getting help for this? You know, I hear that therapy works really well. It's great that you're doing this. You know, I'm really proud of you, or I'm impressed, or, you know, something that's real for you that you can say with honesty.